Assalamu alaikum. The communication day, starting with Mr. Kamel, 78 years old. He's known case of advanced dementia, hypertensive, and diabetes. He was admitted today morning with community-acquired pneumonia. The medical registrar on call decided to start antibiotics according to the local policy of the hospital. His son, Mr. Amr, is refusing to start antibiotics for his father and asked to give herbal medicine instead. You are the registrar on call today. You have been asked to discuss this issue with Mr. Amr. I will start the timer in seconds.
Thank you, Dr. Basim.
Most
Good morning.
welcome. You can
Good
start.
morning.
Okay. Good morning. I'm Dr. Musa, doctor in the clinic today, in the world today. Let me confirm you are. Sorry, how can I call you?
I am Amr.
Okay, nice to meet you, Amr. Amr, are you the next of kin of Mr. Kamel?
Yes, I am.
Okay, Mr. Amr, we are here to discuss about your father's condition. Is it okay with you?
Okay.
Okay, Mr. Amr, to be on the same page, can you tell me how much you know about your father's condition?
Yes, my father is an old man. He is 78 years old. He suffer from long time from high blood sugar and high diabetes and high blood pressure and some memory changes. From few days he developed cough and fever, and we came here yesterday for treatment to treat him.
Okay, do you see your father today?
Yes, I see him.
How is he feel today? How
He
is
not
his health?
he somewhat confused. He not know me.
Okay,
I
let me
don't.
explain. Okay, let me
Okay.
explain about your father's condition.
Okay.
As you mentioned, your father has been admitted to bug infection, two bugs in his lung. And I'm sorry to you, in view of his age, it is a serious condition, and it has a lot of complication, like maybe lead to deterioration of his lung condition. You know, lung is part of our body that is responsible for toxic gas exchange with oxygen in blood. So if the lung deteriorated, he will be in a bad condition. Fortunately, there is a treatment called antibiotic, which this medication can kill this bug, and he started. He reviewed today by consultant and recommended that starting of this medication, antibiotic. So, are you following me?
Yes, doctor. You want
Okay.
to give my father antibiotic?
Yes, this antibiotic is the medication in the best interest of your father's condition.
But I don't want to give my father any antibiotic. I
Can I
read
know?
about it. It has many side effects.
Okay, antibiotic is medication. Like any medication has its bad effect and has benefit. And according to your father's condition and outweighing the benefit versus the bad effect of this drug, the benefit are more. And he is now admitted in hospital and followed by if he got any bad effect, we will monitor him.
But I
Mhm.
okay. But I have bad
Yeah.
experience with these antibiotics. I have one relative who take this antibiotic, and he get another infection in his gut. They called it Clostridium infection, which is so serious actually. So that I don't want to give my father any antibiotics.
Yes, I appreciate and understand your concern, but people differ. People's health condition differ from else. Some people may have this bug infection in the gut, and some not have. But this bug infection, which is in the bug, can affect people with decreased defense system. But in view of your father's condition, we have now to face the existing bug infection, which is in the lung. If we will observe him, and if he had any loose motion due to bad effect of the drug, we will monitor him and treat him.
But we can give him some herpetic medication. It can work.
I totally appreciate that, but let me mention you, this antibiotic is based on many studies, and we tried this more, and tried in many patients and show its efficacy and approved by ministry. But I'm sorry to you that this herbal medication not approved. We don't know the bad effect of this herbal medication and what is the efficacy of this herbal medication. So we are not sure if he developed any bad effect from this medication, which is herbal medication. We can't treat because we don't know this herbal medication yet. So let me ask, do you have any concern? Sorry.
Yes, doctor. If I refuse this antibiotic, are you going to give it against my desire?
I appreciate and understand your concern, but let me ask if your father have any advanced directive or last power of attorney.
No.
No, okay, okay. This, and as I mentioned, this medication, which is antibiotic, is prescribed by in the best interest of your father. It's prescribed by our lung physician, lung doctor. So it is his best interest, and according to your father has no advanced directive or last power of attorney. The doctor, we give him in the best interest of his condition according to the doctor. Do you have any other concern?
No, doctor.
Okay, and I need to assure you, your father is treated now with one of our best medical team, and with this he has a severe bug infection in his lung, and with this medication we can kill these bugs and improve his condition. And otherwise, if we don't give him this medication, his condition may be deteriorated, may have lung failure, and it is a bad condition. Can I know, please, do you have any other concern?
No, doctor. But if he
Okay.
has a complication from the antibiotic, what will you do?
I appreciate your concern, but your father now is monitoring in the ward, and he is treated by one of the best medical team. We followed his back passage, and and we do a lot of tests. And if he has this bad effect from
2 minutes
antibiotic,
left.
and if he has a bad effect from this antibiotic, it is a treatment for that.
Okay.
But okay. Do you have any other concern?
No.
Can I know what take home message you got today from our conversation?
I understand that this antibiotic is important for my father, and he can't treat it from his bug infection without this antibiotic.
Okay, thank
Judy.
you. Do you have another concern?
No.
Okay, let me summarize what we have today. Your father has admitted due to bug infection in his lung, and he is. We are going to give him some medication called antibiotic. It is the best interest of his condition. Also, without this medication, his condition may be deteriorated, and we have a lot of complication like lung failure and this is bad condition, serious condition. And now I will give you some brochures and will give you some links and YouTube links that show you the efficacy and importance of antibiotic in treatment of lung infection. So do you have any other concern?
No, doctor, thank you.
Okay, thank you. Thank you, Mr. Amr.
Welcome.
You have 15 seconds, Dr. Mahmoud. You want to ask? Yes. What else you can ask? He's elderly, living at home.
Yes. With whom your father living, Mr. Amr? Sorry.
He is alone.
Okay. Did he need? Do your father need any support?
Yes, I think he needs support in his home.
Okay, I will discuss with you in the next meeting. It is a lot of options that can we give to you, like providing someone can take care of your father and care him at home, like nursing care. And also there is in our hospital there is a program of home visit. They can visit your father at home and give him all kind of care and any medication, any support. So we will discuss this in the next meeting, Mr. Amr.
Okay, doctor, thank you.
Okay, thank you.
Thank you.
Well done. Yeah, well done, Dr. Mahmoud. Let's hear Dr. Marwa comment, then I will comment. Please go ahead, Dr. Marwa.
I don't have any comment. I think he said everything.
Okay. Perfect. Nice scenario, and I think it's also frequently coming. I will comment only on the jargon, lasting power of attorney and advance directive. Suppose the patient or the surrogate will not know it. So suppose Dr. Marwa will tell you what you mean by this, I don't understand you. In the exam, you have to say it in non-medical term. So what can you say? You can say, does your father nominate anyone to take decision on behalf of him if he's not aware about his condition? Or does he provide any wish or living will if he wants something to be done or to be offered for him? Okay, this is the way how to ask about advance directive and lasting power of attorney in non-jargon way. Okay, Dr. Mahmoud? This is my comment. Yes.
But so in exam, I didn't tell advanced directive or last attorney.
You have to ask, but ask it in non-jargon way.
Okay,
You
doctor.
did it well. You did well when you ask about it because why it's important here because he's telling you, I don't want to treat him by this way. So by what? Why you are saying that? What's your what's your position to decide for that? Your father need to be treated by the best interest, as you said. It's the best interest in his condition, the antibiotics. And the good thing here, you give him example and document that this medication given by many trial and it's approved by the hospital and the whole world authority that it will be very helpful in his condition. What about the herbal, doctor? No, we don't have any approval for this herbal. It's something might help and sometimes it might harm. We don't have any evidence based on it to say this is helpful or not. However, the antibiotics does so, which is it can give the benefit. However, the risk or the bad effects we can observe it. Like what you said, the Clostridium difficile, it's not common and side effects. However, we will follow up this, and whenever we have find or discover he had something, we will interfere on time. Okay?
Okay, Dr. Bess.
Yes. Apart from this, you did.
Thank you, Dr. Bess.
Okay, we can hear the others. Anyone want to comment or to add any point? in
Yes,
this scenario?
yes, I
Sure.
can. So I'm Ahmed Mahanna.
Yeah, Dr. Ahmed, you can go.
So the first thing is this scenario is a patient is 78 years old, has dementia. But in exam, we should vocalize or verbalize that the patient, we couldn't assume he has no mental capacity. We should
Yeah.
say assess mental capacity. So I will ask the examiner, does he have mental capacity? Because I think advanced dementia is a clue, but a general rule in the United Kingdom, they are not assuming losing capacity. They're doing formal assessment for the mental capacity. So assuming we cannot assume, but we should tell the examiner, does the patient has full mental capacity or not? And the answer will be not, because you are talking to, because otherwise I will ask the patient first and take permissions from him before speaking to his son or his daughter.
Perfect, yes.
The second thing I can add, advanced directives and last power of attorney is not a jargon. It's a language, it's the English language. And actually the British people is using it as like daily language. It's not a medical jargon. So I'm using power of attorney. Even I went there to a lawyer to ask for power of attorney. So power of attorney is a native British language. It's not a medical jargon. So it's fine. We can ask, have you assigned anyone to take decision on your behalf when you lose capacity?
Yes.
But I believe lasting power of attorney is just a medical, not a medical. This is just British usual English language.
Yeah.
This is my comment.
Okay, thank you by commenting.
Thank you.
Thank you, Dr. Mahanna. So I will answer one by one, or I will just add comment one by one. For the first point, which is the capacity or the dementia condition in this patient, you don't have contact with the examiner. You can't say, or you can't ask the examiner. You don't have any discussion with the examiner. So the best way to show the examiner that you are taking care of the confidentiality, just to say to the patient or to the surrogate, I assume I had permission from your father to talk about his condition. And this sentence, Dr. Mahmoudi, you can add it into the introduction before or after saying, are you the next of kin? It's a matter of confidentiality, as Dr. Mahanna said. Once the patient is having the capacity, so you can talk to the patient. But if he lost the capacity, you can't talk to any other or the next of kin. What if he has the capacity and you will not talk to him? So that time you have to assume that you got the permission from the patient to talk to his son about his condition. So you can say, I'm here to discuss about your father's condition and assume I had permission from him to talk with you about his condition. You are the next of kin, and go ahead. Okay, this is the way how to introduce or to start the scenario talking about the patient or the sick father or the sick mother. Let's go to the advanced directive and lasting power of attorney. As you said, Dr. Mahanna, in UK, I guess in UK center, they are accepting these terms as non-jargon. But I guess in the overseas, it's not common or it's not a public word in our culture to say, I don't know in Arabic, are you الوصي, I guess, right? أنت الوصي عليه أو like this.
lasting power of attorney يعني توكيل باللغة العربية.
Yes, موكل عنه أو توكيل. But we are not asking by this way. We are asking again by simple way. You are the one taking decision. You are the first relative, or you are the first, the next of kin. By I mean in Arabic. So I guess it's safe to ask by simple way. But I don't have any clue, or I don't have any evidence that if you say lasting power of attorney and lasting of or advanced directive in the exam, they will accept it as non-jargon. I don't know. If someone has comment, maybe it will be helpful for us. But maybe in UK center, they accept these words. Okay. I remember also Dr. Sarah, a couple of days ago, she's saying they accepting fever, they accepting asking about HIV because it's common in UK.
Actually, the day-to-day practice, they are fever, vomiting, diarrhea.
Yes, yeah, I don't know also
This
this
is not a jargon. They are using this language day by day.
but believe me, whenever we are saying this in our centers, they are writing, he's using jargons.
Okay.
As well as the mentors and the tutors, they are saying you are using jargons. Anyway, it's nothing white and nothing is black. Sometimes there is gray zone and you don't have any approval for it. So the best thing is to avoid the gray zone, be in the white or the black. So we said that the black is the jargon, be in the white zone and say the every non-jargon word. Don't say something which is in the gray zone, like vomiting. Yeah, vomiting. All people knows the vomiting. But if you sit with some surrogate and you ask him, "Did you vomit?" and he asks you, "What do you mean, doctor, by vomiting?" You will be in trouble. He will put to you that you didn't explain or you ask in jargon way. Once the daughter or the surrogate asked you what you mean by this, be sure the examiner will not leave you. He will comment on it in his paper. So the best way to avoid this area or this zone, you can say, "Did you throw up?" "No, doctor." "Do you have feeling sick?" "No." Better than saying, did you have nausea or vomiting?" Because it might be jargons. I hope it's clear, Dr. Mohammed.
Yeah, it's clear. Can I add one point?
Yes, sure.
So if this patient needs life-saving treatment, like
Yes,
he has a STEMI and requiring BCI,
yes,
and who's carrying the lasting power of attorney or whatever, decline or refusing it. So he said no, that my dad is too old. He cannot tolerate dual antiplatelet. So what is the solution in this stage?
yeah. The solution is do the life saving for him. What can save the patient life according to the committee or the medical team decision? Because yeah, he might harm his father by his way, right? And the
Yes.
best interest for the father is the procedure or the medication. Unless there is document, the father doesn't want any interaction for any medical situation. If you have like this in his file, do not resuscitate me, do not do whatever, let me die in peace or whatever. But you have to find this document in his file, for example. But if the patient came in unknown situation and you don't know if he has lasting power of attorney, that you don't have any document that he left this advanced directive in his file, and he came in live creatinine condition, you have to interfere immediately. Then realize the file and the document. If he has such issue, you can withdraw the medication, withdraw the procedure, withdraw whatever. But any life saving, you have to take decision according to the medical team decision, regardless the son or the wish of his lasting power of attorney.
Okay.
Okay.
So to rephrase it, last power of attorney carrier cannot refuse life-saving treatment, but
Yes, he can. Yes, exactly.
the patient can refuse life-saving.
Exactly. Yeah.
Perfect.
The most strong document, the patient advance directive, which is written and documented in the court.
Okay.
Okay. Sometimes patient wishes will be more stronger than the lasting power of attorney. The last thing is to consider is the lasting power of attorney.
So if the
This
patient
is
has full mental capacity and he is
yes,
refusing life-saving treatment, we will respect the patient
exactly.
wishes
Yes,
and will not
yes,
go on. Okay.
exactly. Yes. This is the strongest decision from the patient himself, either by verbal decision or by advance directive, which is documented in the court. So you have to believe this is the most strong document you can follow. Apart from this, don't follow any son wish, any next of kin wish, unless it's going with the medical decision. If the patient, if the doctor said, we will not do CPR, right? We will not do heart massage. And the son come to you, please, doctor, I don't want to harm my father. Of course, I will follow because it's it's in the same line with my decision. In this way, I can say, okay, we respect you, and this is also our medical decision, and we want to keep your further dignity and so on. Okay, clear now.
Yes.
But if the son condition, the son decision against your decision, follow what the medical team decided, not his decision. What the medical team decided to, and the best interest for the father, you can follow the medical team decision, not the son decision. In the best interest for the patient. Okay. Okay. Thank you, Dr. Muhanna, for this interaction and the comments. Let's go to the next scenario. If anyone has comment, please you can write in the chat box or you can talk.
Yes,
Mr.
doctor.
Sami? Yes.
Yes, Dr.
Go ahead.
Bassem, sorry. But patient has advanced dementia.
Okay.
So I should take permission also from him, or just tell him I assume to take
So
permission.
how do you know the dementia now is is the patient aware now or no? You don't know, right? The dementia, by the way, the word dementia, it's different in certain patients from patient to patient, as you said. I mean, the response of coliseum deficit differ from patient to patient. This is good solution to say, by the way. I like the way you said that. It's different from patient to patient, okay? And not every patient will have the same condition for coliseum difficile, and it's very rare side effects. You can say all these solutions. If you are stuck with the daughter or with the son about coliseum difficile, you can say, as you said, it's different from patient to patient. It's very rare side effect, and we can notice it earlier, and we can interfere with it. All this solution can help the son to be satisfied. Okay, let's go to the other point, which is dementia. Dementia, as a definition, yeah, it's progressive, but you don't know what level of dementia he has. You have to assess him as their mental state score. You don't know if he's aware. Anyway, just assume that you have permission from the father, unless it's written in the scenario he is comatose. Okay, dementia, maybe he's still responding to you. He can talk to you. He can either have a decision, or he can decide, or he can reject. You don't know what the situation there. Anyway, assume there is permission. What the benefit of this permission? Just to protect yourself from the confidentiality point. Because you don't have any judgment after the discussion with the surrogate as before. You are sitting with the examiner and he's asking you about confidentiality. How to show the examiner that you take care of the confidentiality by this way. We are here to discuss about his health issue. You are the next of kin. I assume I have permission from the father that to talk about his condition, and let's go. What do you know so far about his condition and so on? Okay.
Okay, Dr. Bassem, thank you. Thank you very much.
Yes, well, most welcome. Mr. Sami has cough and AFB positive. Done showed, yeah, tuberculosis. Please discuss with him disease and treatment option. Okay, let's assume Mr. Sami is 30 years.
30 years, yes.
Okay, 30 years. You can add it. Dr. Marwa, be ready. Whenever you are ready, let me know.
Okay, I'm ready now.
Ready?
Yes, I read the scenario.
Okay, no problem. We can go now. Here you go.
Good morning. My name is Dr. Marwa, one of the doctors in Shista Clinic today. Can I confirm you are Mr. Sami?
Yes, doctor.
You are 30 years old?
30 years old, yes, doctor.
We are here today to make some discussion about your health condition. Is it okay with you?
Sure, doctor, sure.
Can I know what you know about your condition?
Yes, doctor, I have cough since I think 4 days. I just returned from travel. I was in India. So when I back to home, I felt I have cough, severe cough, night sweating. Go to the GP and they told me I have some investigation, and today I am come I coming to know the result of investigation.
I'm sorry for that, and we
Thank you.
are doing our best to help you and provide you by needed medications. We are.
Thank you so much.
I have your result that done. Do you have any expectation about this result?
No, doctor, I think it is like common cold or flu. I just came back from India, so I didn't have any expectation. But fever increasing day after day, and also the cough.
Sorry for that. Do you want me to explain more for you?
Sure, doctor, sure.
Actually, the result not as we hope. As
Oh,
it,
doctor. Oh,
sorry for
what's
that.
that?
It
Cancer,
reveals
cancer.
no, not cancer. It
Okay.
reveals that you have a disease named tuberculosis.
Oh,
Do
doctor.
you hear
Tuberculosis,
about it
yes.
before?
Yes, doctor. It is more severe than cancer. My grandmother have suffering a lot from this disease, a lot of complication, a lot of treatment, a lot of medication. Are you sure, doctor, I have this disease?
Yes, we sure of the result
No,
as
doctor,
we
please make sure. I think maybe exchange the tests with anyone else.
in our hospital we follow double check policy and we make sure of any result we give you.
I have heard,
I
doctor.
highly appreciate that is I highly appreciate your feeling now at this hard situation and fortunately this treatable disease.
Oh, my grandmother, doctor, suffer a lot from this disease. Has a lot of complication, has a lot of medication. I think many tablet. I know this disease well, doctor. I know this disease, but I will not need this medication. I will not take this medication.
I appreciate your feeling, Mr. Sami, but also the stage we discover the disease is important in the treatment. Now we discover you in early stage, so that the treatment and the medication will be more beneficial for you. Maybe your grandmother have discovered this disease in late stage or didn't take her medications, so that she suffered. I want to explain to you this disease. You said you know it is affect your lungs and make you cough and make you feel sick, feverish,
Yes, doctor. I know this disease well.
and,
I know
and
this.
make you lose some weight. But it's important to know that medications for this disease is very important to you, and also for to prevent spreading the infection to surroundings.
Okay, doctor. Okay, I know this.
Spreading this bug. I mean,
I know.
spreading this bug to the surrounding.
Yes, doctor. I know this disease well, very well.
You have children,
But yes, doctor.
so
I have.
it's so important to prevent transmitting this disease, this bugs to your children and your family.
Okay, doctor. Okay, I will see. But I need other treatment other than this tablet. It is a lot of tablet, doctor.
Yes, it is a lot of tablet, but we will um, make a team from chest doctors to see what most suitable medications and the most suitable period of medications to you and how to make it easy to take and make plan to make it easy for you.
Okay, doctor,
Can
but you know, I travel a lot. I am businessman, so I travel a lot. So how can I take this medication with traveling? This is my work, and I can't leave my work.
I appreciate this concern, but having this disease and this present in your sputum sample, meaning that it's can translate it to another people. So I highly advise you not to travel and not to go many places to prevent spreading these bugs.
Okay, doctor, I will see, but I can't promise you.
You can take your time to you.
Okay, doctor, thank you.
Okay.
Thank you very much.
Do you have any concern?
Yes, I concerned about treatment. Could you can you give me any module of treatment other than this tablet? Any type of any module other than tablet?
The treatment for this disease usually multiple treatment, multiple antibiotics. This molecule, this substance prevent this bugs from increase its growth and spreading in the body. It can affect many sites in your body. We will discuss this with our professional team, trying to make the less effective amount of treatment.
Okay, doctor. Okay.
Can
So
I
you
ask you
sleep?
some questions?
Sure, doctor.
You said you are travel. What your job?
Businessman. I am businessman.
Okay. With whom you live other than your children?
Yes, my wife and 2 children.
We will teach you methods to follow it in your home to prevent the spreading of this infection to your children and your wife. Do you smoke, Mr. Sami? Do you smoke? Hello? Hello?
I think there is connection problem between the side. I pause the time.
Yeah.
I'm waiting for him. Dr. Mahmoud, we can't hear you. Seems your mic is on, but we can't hear you. Either set your mic or reconnect back, Dr. Mahmoud. Yeah, there's some. Yes.
Sorry, doctor. Sorry.
Okay.
I was asking you, do you smoke, Mr. Sami?
Yes, doctor. Yes.
I advise you to stop smoking, as it's bad effect of smoking on your lung, and you know this your lung now is have bugs and can affect it much by this smoking. I can transfer you to smoking cessation clinic to help you to stop smoking. It is okay with you?
No, doctor, I can't give up smoking.
Why?
I smoke since I think I was 15, so I can't. It is very impossible.
But
Very
you know,
impossible.
but smoking affecting every organ in your body, especially your lungs, and your lungs now are diseased. So it is.
Okay, doctor, I will think about that. I will think.
Okay, I will give you some brochures about the TB disease, tuberculosis disease, and about also the effect of smoking on your lungs.
Okay, doctor, thank you very much. I have another concern, doctor, please.
But
Um, can I travel after 2 days?
no, you can't travel.
Okay, doctor. If I insist to travel,
sorry to tell you, we will not let you travel.
okay, doctor. But I need. Okay, doctor. Okay.
Okay, time is up. I think we extended 40 seconds more for the last concern. But in general, Dr. Marwa did great as first time. It's perfect. We will hear Dr. Mahmoud, then I will
It's
comment.
great, but it is a complicated case, Dr. Marwa.
No problem. Yeah, give her the comment, then I will comment. But she
yes,
did
doctor.
as the first time. Give
Yes,
her
yes,
the-
very good, very good. But
Yeah.
but there is an important thing is you missed, Dr. Marwa.
Yes, just give her the
yes.
comment, yes, please.
Yes, I first I told you my grandmother I know here well and suffering and has a lot of complication. You can assure me and told me that the outlook of tuberculosis is changed with new medication. I told you my grandmother. So it is old treatment. Now the new treatment and the outlook of the disease is changed. You can assure me. First thing I know well, I told you I know well about tuberculosis, and in the case he told you that treatment plan. So you should go on treatment more and more. Told me that there is you will take 4 medication for 2 months and the other 2 medication in the next 4 months. So the course of treatment will be 6 months. And the treatment can be given by direct observed therapy like that. And then it is important any treatment should tell him the complication. He give you the tuberculosis treatment, so it is a lot of complication. Go on soreness of the nerves, like change in blood test, like elevation, especially liver function test, and maybe change your water work or your tears. So you should and also the solution of any complication, like soreness of the nerve cable. Maybe we will give you some vitamins and also avoid contact lens. And the most serious complications, most serious and site saving, it is that isambetol, that change in color vision of your eye. So you should tell me that if you feel anytime that you have color changes, you should report it to the doctor immediately. So we will stop this treatment. It's the first thing. I told you I come back from India since 4 months. Sorry, so 1 week. So TB equal HIV. Equal. So you will not ask me, are you have blood transfusion? Are you have? No. You told me that TB is transmitted by droplet infection from one person to another, but it is a super bug. Can't infect normal people with normal defense system, but it may affect the people with decreased defense system, like patient has diabetes or taking steroid or HIV. So the next, will you ask me, have you ever checked your HIV status? I will tell you I am HIV. So I will tell you I am HIV. So in this comment, I am HIV and travel, but I am on treatment. It is the second thing, and the third thing, the isolation in hospital. You should tell me that you should be isolated in the room with negative pressure till you're free from this bug. So what do you think? I will tell you, no, doctor, I will not isolate it. I am a businessman and I have a home and I can isolate in my home. So in the next, you will tell me what is the circumstance at your home. I will tell you I have my children, 2 children, and the wife, but I have a single room. So you will tell me, okay, keep at your home with single bathroom and the private instrument. The fourth thing, yes, it is screening. I will tell you my son has fever. So you will tell me you should bring your son to proper screen him if she have the bug or not, and take medication. That is the case today. Thank you, Dr. Amaro. You great. You do it great. Thank you, Dr. Bassem.
I do 20%.
No. Very good.
No. Yeah,
Very good.
thank you, Dr. Mahmoud, for the explanation. And again, you did great. You're fluent, Dr. Marwa. You didn't stop a long time. You kept understanding, asking for understanding. The introduction, I think as first practice with me, I mean, it was great. But the Dr. Mahmoud comments, yeah, respectful one, and I will stress on some of these points again. The best, or sorry, the most important point to stress on in this scenario is the isolation. Isolation. You have, it's open TB. It's mentioned to you, the AFP is positive, means that he's infectious. So the best way to treat him in this period of infectious condition is to isolate him 2 weeks in the hospital. This is the best and the maximum and the optimal management step. If he refuses, you can accept his isolation or home isolation in one occasion. He has separate room with good ventilation, with a separate room, bathroom, away from his kids, away from his wife for 2 weeks. If not, so sorry for this, I can admit you, or I should admit you in a negative pressure room at hospital. Don't forget the ventilation in his room if you accepted this. The room should be isolated with sun exposure and good ventilated or good ventilation system. He shouldn't stay in closed room with no ventilation. He will infect others. And who's the others? His family, his beloved persons. So it's never ever to leave him or let him go home. He must be admitted either 2 weeks or the repeated AFP will be negative. Okay. Regarding his travel, you have to find a solution for the travel. Sorry, and always say, I appreciate your concern. Don't say no, you can't. Say, I appreciate your concern, I appreciate your work, but I can't let you travel in this condition. You might harm yourself apart from others. You might harm the passenger in your flight. For this, you can't travel. Okay. If you can, I can find a solution for you. You can do virtual meeting with your company or your business work, whatever his job. Okay. Let's go back to the other points I wrote in my paper here. Yes, the work, as he said, yes, I'm working as businessman. Yes, you can do most of your work in the hospital, even by virtual meetings or video call or whatever. But sorry, I appreciate your work, your care. You have to be admitted for 2 weeks. This is the most important point in the clinical judgment. You can't leave him go home, or unless he has, as I said, the solution in his room or his home condition, he should stay in. Okay, let's go to the point of contact. You should ask about his contact. As Dr. Mahmoud said, one of his kids has fever. So who sit with you or who had a contact with you in the last period? My son, my wife, whosoever should be screened if they have symptoms. Okay, this is regarding the contact. It's important point to mention.
Offer
Okay.
to do a screening test for the family?
Yes, family member who had close contact with him, or he had symptoms recently, as Dr. Mahmoud said, fever or cough or whatever. Okay, the explanation of the disease, you have to say that it's sober bug. However, it's treatable one, as you said. You can give him home because this is controllable and treatable one.
If in this case, if the patient asks about if we will inform his work,
Yes, it's supposed to be done. If he's working in a company, he should inform them that he has this, or
encourage
if
him
he
to
insists,
encourage
if
him
he
to inform them by himself, not by us.
yes, by himself, not by us. We don't have this
Okay.
authority to disclose it. However, if he refuses and he is insisting to go to his work and to go to have a contact with others, in this way you can disclose this to the authority or to the company or whatever the area he want to go. Even the flight, as you said, you can't travel. If he insists, I'm so sorry, we can inform our the localized office for responsible for the infection, and they might detain you because it's not allowed to leave this patient go out and he will infect others. Okay. The point of interruption, I wrote here, you are interrupting him. He's talking and you are trying to talk while he's talking. Always give him the chance to talk. And when he finish, you can reply him. Okay. Ask also for the following. I wrote this. Are you understanding me? Did you follow me? Or whatever. This is what I wrote in my paper. But in general, you did great. And the question for the grandmother, as Dr. Mahmoud said, you can say like that, or you can say, we don't know about the situation. However, now the condition is totally treatable, and you can live near normal life whenever you have following our regime of antibiotics, which is 6 months combined medication. And for the combined medication issue, you can give him solution. It can be given as combined pills. You can take 2 pills in one or 3 in 1 or whatever. Just give him this solution. And you can address also other concerns. Why you don't have time to take anything concerning regarding the medication. And according to the concern, you can address it. Sorry, doctor, yes.
About his HIV infection, what to say to him?
I'm not sure about every patient should be HIV to have this TB. Yes, most of the immunocompromised patients, yes, Dr. Mahmoud, I agree. But it's not necessary to ask him about why your defense system, for example, is weak or you have any other condition. Suppose if it is written in the scenario, to be written, or he will offer it during the discussion. But how I can guess this patient should have
I
something?
think Dr. Basim, because the patient is young. So patient young, how can get TB? I think that I don't sure.
So
I didn't.
yeah, I get your point, but you can get the TB, but it will be latent TB. Any patient like that, but he will be manifested maybe with the sick or direct contact with the sick person. You can have this TB. I mean,
Yes.
you got
Yes.
my point.
Mhm,
But how to expose or how to explore it from the I don't know how to ask it. It will be like taking history. If you said, may I know why you have weak system or you have weak defense system? I guess it will be written in the scenario, or the surrogate will say it to you by volunteer. He will tell you, doctor, I have HIV. Is it related to that? That time, Dr. Marwa will address this point. Yes, it's something can give more chance for this bug to be in your body, but not every TB patient will be HIV positive. You got it?
Yes, Dr. Basim. Yes, sure.
We can hear also from others sharing if someone has commented regarding this point, because I'm not sure if everyone should be having immune deficiency or something in his immune system.
I have
Anyone?
a comment.
Yes.
Yes.
Sure,
So
Dr.
this is
Mahmoud.
thank you, Dr. Mahmoud and Dr. Marwa. This case is my exam case in the first trial for
Yes,
me, and
Dr. Ahmed. Yes, Dr.
it
Ahmed. You told me
it
that, and I give him.
it was very difficult and
Yes.
reluctant patient, and he keeps
Okay.
saying I won't travel because my mom has stroke in Hong Kong, and she's unable to manage herself on her own, so I have to go. And actually, I failed to convince her to stop. And the other comment: TB is notifiable disease.
No, it's not. Sorry, yes. TB is notified, but HIV not. Okay, go ahead.
Yeah,
Sorry to interrupt
TB
you.
is notifiable disease. So we
Yes,
should
yes.
inform the NHS.
Excellent. Yes, this point also should be added.
So notification, smoking covered, well done. Travel, HIV. I think HIV, because TB and HIV usually very high percentage of TB has HIV. That's why they are
Yes.
putting together. As Dr. Mahmoud said, just patient education about the antituberculous medicine, like what he said, pins and needles because of peripheral neuropathy of isoniazid, and assure him that we will add pyridoxine, vitamin B6, and just change of the urine. Pirus asks, this is benign, nothing. Color vision for ethambutol, and they can ask medical advice. The thing we miss is the hepatitis. If your color turn yellow, immediately seek medical advice, because isoniazid can cause hepatitis.
Yes.
Yes. So notification, I will inform the patient that I will notify the health authorities. And she keep insisting on travel. So what should I do? As you mentioned, I will inform the legal advisor. What should I do? If they keep rejecting, I would travel.
Yeah, find a solution for her travel.
Yeah, we tried. I will call the GB in Hong Kong. I will try to fix. You can send your father, your brother there. So we can bring her by special flight. So we put a lot of alternative, and she keeps saying no. So
Did you explain the seriousness of
yes,
being travel?
and the risk of transmission, and your safety
Yes.
is our priority.
Yes, and others also. Yeah,
and
community,
the community,
exactly.
and the community will be in danger, and I will travel. So I 10 minutes passed without finding a solution, because
you know why? She want to hear something. If she hear it, she will stop.
What is this?
I am not sure. What about the feedback? What they wrote for you about feedback? Did you receive your feedback about this
I
scenario?
didn't know.
You have to ask for feedback. Usually, we know from the feedback what they want to hear from you. Why they fail you in this station? Did you fail this station?
I passed. I passed the communication. But
So you passed this station.
yeah, but
Good.
But I couldn't find a solution finally.
But it's okay. We don't care about the solution. We care about the past only. Anyway, maybe she want to hear something. Sometimes they are using the virtual meeting, the video calls as a solution for such issue. Maybe I'm not sure, but this
The
way you
problem
can.
is her mom was very dependent, and she's not managing her own. So she should be, the surrogate should be there with her mom. So it's difficult to do anything virtual. So I advise to bring your mom here, or just contact GB social worker there to find a solution. Someone can, special nurse can sit with her. So we offer the alternative, but she keep asking no. So I'm not sure where we are. So it's too tough.
So if you said to him, you can transmit infection to your mother.
Yes,
What
maybe
is
this
it?
is another solution to convince. Are you worried about her? If you go to her with this condition, she will definitely get the infection from you.
Okay.
That's why you are protecting her as well as protecting you. Maybe she will be convinced. If you don't, you can offer the virtual or video call. We can let you call her video call, and we will arrange with the other hospital how to contact your mother in a way to convince you and to be sure about her condition. So try to be around this area of this solution or this idea of video call, virtual meeting, something you can do it like you are there by yourself, which is the video call. I also face scenarios with wedding of my sister, wedding of my brother. And the solution was also to have a video call with them during the wedding. So it means that you are physically almost there by the video call face to face while you are still not there. But it's better to be away from them just to keep them safe from your infection. You got this point.
Yes.
So yeah, you can use this idea in any travel issue and don't miss the point of transmitting the infection to others. It's not the point of your safety only, even the community safety. You might transmit this infection to the community and it will be horrible if others will get and the others will give to the others. So we are protecting the others as well as we are protecting you. Don't focus on the others only. Focus on here also. So stress on this point about here and others community. Sorry, others safety. Okay. And again, as we said, it's the important to pass whatever the situation. Hopefully, we all of us pass this exam and finish this drama. Thank you, Dr. Ahmed Mahanna, for your experience. Always share with us the ideas, especially in the exam. I guess your center was in UK or overseas?
Is this UK, Scotland?
Yeah, UK. They are tough enough to fail a lot of candidates, I know. But anyway, you can do it. Hopefully, inshallah,
Okay.
next time.
Sure.
Any other comment from others? Any question? Call police. Oh my God. Call police. It's like confrontation and you might fail immediately.
And Dr. Bassem, is it possible to say that I'm gonna escalate and involve the consultant and the team as well to
Yes.
to talk to you about the
Yes,
serious
exactly.
how serious
Yeah.
is the situation in this?
Yeah.
Okay.
Always when you are stucking with the candidate or the surrogate, as Dr. Ahmed, by the way, this is also one of the solutions. You might say it and she will be quiet after. If you tried everything, you can say, I can arrange a meeting with my consultant. He's best and he's better than me to convince you. And he has his own way to convince you, more expert than me. In this way, I guess, like uh, you are saying to her, shut up, but in good way. So don't talk again. Whenever you want to talk, talk with my consultant in another meeting, but in good way, polite way. I'm sorry. So I can arrange a meeting with my consultant to sit with you, and he has his perfect way to convince you, and he has a lot of solution to address with you. In this way, she might or she should keep quiet after that to be satisfied, and you can skip to the next point.
But
Okay?
if we said we will arrange a meeting, does that mean he will leave now and come again
No, no, no. A meeting in the hospital. He will never leave
in
the
the
hospital.
same day, مثلا?
Yes, as soon as possible. Don't give same day or don't give time frame. Tell to her, we will try to make this meeting as soon as possible in order to give you the updated plan also as soon as possible. Okay. Good way, Dr. Minna. Thank you for this
Thank
solution.
you.
Yeah, thank you so much. And this solution, not only in this scenario, by the way, you can do it at the end of any difficult to convince surrogate, any difficult procedure or a refusal of treatment or medication, counsel about disease, genetic counseling, anything you are stuck with the surrogate, you can offer this meeting. Okay? And it's
But
safe one. Mhm.
I mean in this infection, yeah, he
Mhm.
is allowed to leave the hospital or not?
No, 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 no. He will leave on one occasion only. I said whenever he has ventilated sun exposed room with special or separate bathroom, and he will stay away from his son and children 1 meter at least in distance while he's talking and so on. If he will not follow these rules, I'm so sorry, better to be in the hospital for 2 weeks or until the result will be clear.
Okay.
Okay. Yeah, regarding to the result, Dr. Marwa, a good thing also to say, we always delivering this news after we double check the result. Okay, we are not saying to any patient that he has serious infection unless he has, or we have double checked the result. The concern also of cancer, he said, yeah, it's not a cancer. Sorry, you can hear me?
Yes, Dr.
Yes,
Bassem. Yes.
yeah, it's a treatable condition, as you said. So TB patient might live near normal life, but don't miss the notification, as Dr. Ahmed said, Dr. Mohammed. It's very important, and I miss this point as well. Okay. Any question from others? Any question, please? Thank you, Dr. Marwan, Dr. Mahmoud, Dr. Hanna, Dr. Minna, all the commented and sharing with us. Please feel free to comment, to ask, to share with us. And Dr. Mohanna, always share with us your experience. It's very helpful for us. Okay. If no more question, we can end the session. See you tomorrow, inshallah, with clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام ورحمة الله وبركاته.